My name is Judy Giel. I'm Chief Clinical Officer at Pediatric Home Service, and I am here to speak with you, our field nurses, today to give you an update on where we are in the development and evolution of our home care nursing model. You're well aware there is a very big nursing shortage in the home care setting. Even though Minnesota graduates about 7,000 nurses a year, there are multiple opportunities at healthcare facilities, long-term care facilities, doctor's offices, clinics, home health, and home care. We listen to you. We've heard you tell us how important it is that you're able to work a reasonable schedule, to have adequate number of hours, and to have a varied clinical experience so that you can develop your nursing profession. In order to do that, we've determined that retention of our field nurses is a top priority. We can't do our work without you. To that end, we realized our nursing model has to change into what I'm calling a little more transitional in nature. In the past, when a medically complex child was identified in the hospital, we called in the cavalry. We told our families, you're going to need nurses and you're going to need a lot of nurses to help you care for your child in the home. And we swooped in and we assumed cares and responsibilities and tried to help our families. What we realize is that our families are entitled to get their child home when the child's ready to go home from the hospital, and to have their confidence built by a highly professional and highly skilled nursing staff. Ultimately, they'll develop the competence to manage the overall care of their child. So that is our goal, and that change is that we want to build the confidence and competence of our families in caring for their complex child. And one thing I want you to know is that there are some families whose children will always require a high level of care. We are not going to leave those families in the lurch, but we can't guarantee 24-hour nursing 7 days a week. So we're asking them to have backup caregivers identified, and we will train them and build their confidence to help the family care for their child. Some of our families we have been in conversation with when the level of care required no longer is skilled nursing care. And the definition of skilled nursing care is skilled nursing assessments, skilled nursing interventions, and skilled education and training. Sometimes our children get stable enough, their care becomes routine or regular and able to be handled by a non-licensed person. In those situations, we're trying to provide at least a 2-month notice to help the families make a transition to perhaps a PCA level of care or a non-licensed professional to assist them in some of the activities of daily living. We're developing a comprehensive toolkit that will help not only us here at the office as we start those dialogues, but also may be supportive of you and something you might use to reinforce and support the families as we begin to discharge our precious patients. Equal to our commitment to our patients' and families' experience of pediatric home services care, we want you to have an experience that working for pediatric home service, you are able to pursue your career goals and aspirations. We've been working on this for the last 6 months. We're really excited about some of the results that we've gained and the experiences we've gained. I can tell you, recently we increased the length of stay for our field nurses by 2 months. That's a cause for celebration. We've gone to block scheduling because we listened to you and we heard that it was important for you to know what your schedule was on a more predictable basis so that you could plan your personal lives around your work. We have a number of clients that we're looking at discharging home over the next 3 months, and will continue to do so throughout the year. That's why we want to keep you in the loop and keep you updated, and plan to do so at least every 2 months. In the meantime, if you have any questions, concerns, thoughts, ideas, contributions, I'd love to hear them. Your nurse supervisor is available, your director of nursing, Carletta Crawford, is available, and I am available. Please reach out at any point. We value you so much. And thank you for your service.